To everyone watching, your regular buddy check on the 22nd of each month could be more critical than you realize. It may help save a life. Let's talk about a person's health, certain life situations, and changes in behavior that can be signs that someone is at an increased risk for suicide. A person's health can place them at higher risk of suicide. This may look like living with mental health issues such as depression, anxiety, and schizophrenia, increased alcohol or drug misuse. For some, this can mean they are self-treating symptoms of mental health issues, a history of suicidal thoughts or survived an attempt, or a serious physical health issue like chronic pain or a diagnosis of terminal illness. There are also situations in a person's life that can place them at increased risk: loss of employment or having financial problems, a recent unwanted move like an eviction or a relationship ending, the loss of a loved one, especially if by suicide. It is also important to look for changes in behavior. If they are normally outgoing, but recently are withdrawn from friends or no longer wanting to do their favorite activities, eating or sleeping too much or too little, not bathing. If someone makes statements of feeling hopeless, worthless, a burden to others, or how they feel like they no longer have purpose, it is important for you to know that the time it takes someone to go from having thoughts of suicide to attempting it can be short. When you do a buddy check on the 22nd of each month, look for the things that can place them at an increased risk of suicide. In this video, we discussed a person's health, certain life situations, and changes in behavior that can be signs that someone is at an increased risk for suicide. If you notice any of these signs, don't wait to reach out and ask the question: are you thinking about suicide? If needed, call the 988 Suicide and Crisis Lifeline.